Hello, everyone, and welcome to this audio podcast. This audio podcast as part of the Advancing Healthcare Awards, or AHA 2024, and sort of nomination audio podcast edition. This audio podcast is part of a chartered edition. This audio podcast is part of an evidence-based edition, and this audio podcast as part of a blast feature, and this audio podcast as part of a Storm Robotics production. So in this audio podcast, in this audio podcast, I look at an overview in another category under the Advancing Healthcare Awards 2024, and this category looks at Biomedical Scientist of the Year award, Biomedical Scientist of the Year award. So in this category, a few questions as part of this, a few questions with the responses as part of this audio podcast. So one of the initial questions is why should the nominee be considered for this award, and what are their achievements? So the response to this question is that Shahid is a biomedical academic and chartered scientist under the Science Council. He is a registered scientist under the Healthcare Professions Council, and a fellow for the Institute of Biomedical Sciences. Shahid has focused efforts between academia, pathology, and laboratory medicine, being involved between healthcare sectors. Shahid is the Chief Scientific Officer for the Renal Patient Support Group, or the RPSG, and has been since 2009, and an academic lead for the Kidney Disease and Renal Support Group, or KDARS group for kids, since 2014. The two platforms have expanded globally as go-to sort of the go-to space, the sort of go-to spaces, with over 12,000 service users between the two platforms. The second question as part of this nomination is how have they raised the profile of biomedical science and progressed the profession. So Shahid has mentored our colleagues and teams within the NHS and industry. Shahid has raised and sought to progress the profession, representing scientific practice, leading the RPSG, leading the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS group for kids. And representation has included but not limited to the Institute of Biomedical Science Congress, the European Working Group for Psychosocial Aspects of Children with Chronic Kidney Disease, CKD, the Royal College of General Practitioners, the Royal College of General Practitioners in the UK, the UK Renal Registry, UK Renal Trials Network, the International Pediatric Nephrology Association, the International Pediatric Transplant Association, the American Society of Nephrology, the Royal College of Pediatrics and Child Health, and Royal Society of Medicine, and the British Association of Pediatric Nephrology. In round the third, one of the third questions as part of this category, how does the nominee demonstrate leadership and team working skills? So between the two platforms, there is and are patient focused founders and co-founders, administration and moderating teams aligned with Shahid's leadership. And through collaborative effort, Shahid has formed several publications and presented work locally, regionally, in various European countries, virtually and internationally. Shahid has led a science focus has led a science focused throughout to encourage patient and healthcare professionals' involvement to work together in meeting mutual objectives regarding scientific practices and primarily linked to the National Institute of Health Research (NIHR) involvement framework, and additionally toward the National Institute for Care and Excellence and the Medical Research Council remits. And the leadership throughout prompts peer-reviewed works across social media platforms. In around sort of the final question as part of this nomination, is outline how the nominee is innovative and has improved best practice in the workplace. Shahid has acquired a skill mix across healthcare professionalism and research to advance scientific practices. Shahid's work through both RPSG and KDAR's social media platforms to prompt patient involvement and unity between healthcare service users and providers. Working with healthcare sectors and commitment to meet best practice developing evidence-based practice between the two platforms has encouraged more joined-up thinking. Throughout, Shahid has collaborated with patients, healthcare professionals, academics, and researchers implementing science for patient care. That draws this audio podcast to a close. This audio podcast is part of a chartered edition. This audio podcast as an evidence-based edition. This audio podcast as part of an Advancing Healthcare Awards AHA 2024 nomination edition. This audio podcast as part of a Blast feature, and this audio podcast as part of a Storm Robotics production.